And joining us to discuss the issues of blood clotting among those who have received the Oxford AstraZeneca vaccine is a medical doctor from Basildon University Hospital, Femi Oyekan. Good to have you join us, Dr. Oyekan. The last time you and I spoke about the Oxford AstraZeneca vaccine and blood clotting, reported blood clotting, you were not sure if this was just a mere coincidence of this, if this should be a genuine concern. With this latest report in the UK, where are you now?
I'll say first, thank you for making me part of this conversation. I'll say that from the facts available on the ground, there is a strong possibility that those who are below the age of 55, even though the incidence is about 1 in 1 million or between 125,000, 1 in 125,000 to 101 million, it is very, very low. But the thing is, if whoever is affected, if it's your person, it raises concerns. So that's why I think that the issue at the moment is more like if I were to advise a young person who has options of vaccine, I would say at the moment hold off, because let's get some clarity from some authoritative body like FDA, like EMA, like or other regional authorities as to what clear directions regarding the Oxford AstraZeneca vaccine, because at the moment we've seen incidents of people who had the vaccines coming up with blood clots and significantly low platelets.
So the condition is medically called CVST, which is cerebral venous sinus thrombosis. I hope I got that correctly. And it is blood clotting in the brain. And it's also reported in 2 people who took the Pfizer-BioNTech vaccine. What does this indicate about how people will react to the vaccines in general?
Well, I'll say that initially, from the outset, what we're saying is the possibility that the vaccine, COVID itself is a hypercoagulable infection. It makes your D-dimer to go up. Sometimes it causes deranged in blood clotting factors. But in addition to that, what we've seen is the fact that these vaccines, the BioNTech, the Pfizer, the AstraZeneca vaccine, have also been linked. We've seen incidents where people between 4 to 20 days who have received it come up with some incident of cerebral venous thrombosis or DVT or PE. Any of these clots could be found anywhere. It could either be in the brain, in the chest, in the abdomen. But what we're doing is there's an ongoing study to find out anybody who develop these symptoms. We're trying to collate incidents, we're trying to collate data to be sure that we are going to be reporting either to individuals or to press or maybe to any organization credible facts about what is going on. But at the moment, I'll say that in all of this, getting the vaccine itself is still, the risk is by far better than whatever adverse effect comes with it.
And you just echoed what the Medicines and Healthcare Products Regulatory Agency in the UK has said, which is that the benefits of the vaccine continues to outweigh the risk. Now, this conclusion has also been re-echoed by the Europe Medicines Agency and the World Health Organization. But with all of this happening, how do you balance that with vaccine safety?
Vaccine, what do you call it?
Vaccine safety.
Vaccine safety.
Yes, to ensure that this vaccine is safe enough for people to take them. That this balancing, ensuring that we are saying that the vaccine is safe and the benefits far outweighs the risk. So how do you balance this with, people who already have the vaccine hesitancy? How do you balance this with vaccine safety?
Well, I'll say that first, COVID is still very new. Most of these vaccines are only authorized for emergency use. So most of them don't even have the full authorization yet, because the truth is that They are very new. The studies are still ongoing. Some of them have to use some very novel methods to come about, like the synthetic mRNA by the Pfizer vaccine. So in all of this, I think that science are doing a lot of jobs to be sure that once this product gets to the public, we are trying to give our best to the public to ensure that things return back to normalcy. So this is not like people are deliberately trying to maybe harm anybody or cut corners. It's just the fact that it's the peculiarity of the situation the world has found itself. COVID has shut virtually everything down. There are some businesses that have gone and are never going to come back. And in a way, in order to restart livelihood, in order to restart, we're coming up with some of these vaccines that, even though the trials are not even in a way very conclusive at the moment, but they've shown to be life-saving, to be game changers. So in a way, we're going to say people should go ahead and as much as you can to take it. I've taken mine already, so it's not like I'm telling people to do what I've not done or something that I'm not willing to do. But in all, we're still going to look at what the results are and then start making modifications, because studies itself are progressive. There are hypotheses that were held yesterday, and when new knowledge, new innovation comes, you discard them and then you try to make progress. So people may have vaccine hesitancy.
Just allow me quickly jump in, Dr. Oyekan, because I have a few minutes. But I just I like that you mentioned that we're learning more as we continue to deal with the coronavirus daily. But so the issue of vaccine safety came up because there are those who are quite skeptical, because they wonder that, look, this vaccine were made in a hurry. We've had a lot of diseases and we've not had vaccines in years. How come we can make the coronavirus vaccine in such a short period of time? We already have that issue, and that kind of messaging is now complicated by this blood clotting reports we're getting from countries who are administering the AstraZeneca vaccine. But is there also, because some people are saying, look, this is more prevalent in places like in Europe and North America, but not necessarily in India or in China or in Africa. Are there studies to show that there is different side effects to these vaccines, if there is at all, in different continents or among different races?
At the moment, I'll say there are no data available, to the best of my knowledge, to say that maybe there are racial effects or maybe the continental discrepancy in terms of the effect and side effects of some of these vaccines. There are no credible data available. But what we know is the fact that when you compare the rate of vaccination, like in UK, over 35 million people have already been vaccinated, compared to Nigeria, where I don't think, in a population of over 200 million, I don't think you've had maybe 100,000. So in order to be able to gather credible data, you need to have more and more, data to be able to make your conclusion. But if you look at it in all, Europe, America, and some other part of the world are shown to be more ahead in vaccination compared to Africa. So it is very likely that we can make comparison using the data they are provided to us, because there are more information available from their end.
Absolutely, and it's interesting you mentioned that they have these countries have vaccinated more than African countries. We'll continue to push people to take this vaccine, because again, we need herd immunity to deal with the coronavirus pandemic. Medical doctor from Boston University, Femi Oyekan, thanks for talking to us.
You're welcome.